Miss Bryan, and a warm good evening to everyone. It is exactly 2 months since we have been controlling or responding to this wave of COVID-19 infections. During this period, between May 19th to today, July 13th, 495 cases have been added to the Federation's COVID-19 tally. We have now reported a total of 540 COVID-19 confirmed cases for the Federation, with 522 cases for St. Kitts and 18 cases for Nevis. 55 inmates within the prison system have been diagnosed with COVID-19. 44 inmates have recovered, with 11 active cases remaining. The matron of the prison and a team of case managers from the Ministry of Health are monitoring the impacted inmates who are isolated. 15 prison staff members have been diagnosed with COVID-19, with 3 recoveries, and 12 staff members are still recovering. We have had a total of 423 recoveries since the pandemic. Currently, the COVID-19 ward at the JNF General Hospital is void of patients, and we have reported 3 COVID-19 related deaths. The team of senior nurses and doctors is monitoring the remaining 114 active cases. The daily case count peaked between June 11th to June 23rd and has been on the decline since. In essence, the COVID-19 outbreak in the Federation is under control. The COVID-19 vaccination program was launched on February the 22nd, 2021, and in 5 months we have achieved the following coverage rates. 70% of the target population is now covered with the first dose of the vaccine, and 57.9% of the target population fully vaccinated. Let me pause and explain. So 70% of the target population, which is equivalent to about 33,037 individuals, have been covered with the first dose of the vaccine. So in other words, we still have a remaining 30% of the target population to be covered. I want to use this opportunity to commend the 23,123 persons who have come forward and accepted the AstraZeneca Oxford vaccine so far. When you compare St. Kitts and Nevis with the other territories that comprise the Eastern Caribbean Currency Union, with respect to the percentage of the total population vaccinated against COVID-19, the Federation is performing well. In St. Kitts and Nevis, 49% of the total population is covered with the first dose, and about 41% of the total population is covered with the second dose. The Federation is second only to Anguilla, which is leading. Anguilla has covered 62% of the total population with the first dose, and 51% of that population is covered with the second dose. This is a good position. The COVID-19 vaccine is the best ammunition we have in this fight against the SARS-CoV-2 virus. The COVID-19 vaccines are providing a path to normalcy. So what's the way forward? The way forward involves us living with COVID-19. Today is the second day of reopening since the lockdown. We have embarked on a phased approach in reopening the country, as outlined in the Statutory Rules and Orders number 30 of 2021. However, the COVID-19 virus will remain a fact of life. We have controlled this outbreak and the daily case count is low. However, we will not become virus-free anytime soon. We will continue to have newly diagnosed cases daily and weekly. It was Edward Steinham, an infectious disease specialist, in an article in the Wall Street Journal dated July the 11th, 2021, who said, and I quote, "This is a virus that we are going to have to learn to live with, and we are going to have to learn to manage, and we are going to have COVID-19 patients for the foreseeable future," end of quote. So what does living with COVID-19 mean? Living with COVID-19 means coming on board and accepting the vaccine if you have not already done so, because it is a protective measure. Living with COVID-19 means adopting the COVID-19 protective and preventive measures, including wearing the face mask at all times, maintaining adequate hand hygiene at all times, and maintaining a safe distance of 6 feet from others when in the public domain. If you are experiencing COVID-19-like symptoms, it's important that you remain at home, seek COVID-19 testing and medical care. If you are diagnosed with COVID-19, either you will be asked to isolate at home or at a COVID-19 facility, and you have a duty and responsibility to adhere to the terms and conditions of such an isolation order. If diagnosed with COVID-19, you have a personal and social responsibility to limit and reduce exposure of the virus to others. If you have had contact with someone who is diagnosed as having COVID-19, you will be asked to quarantine at home, or self-quarantine as it were, and you are expected to remain in the confines of your home for that stipulated period. This is what living with COVID-19 means. These simple guidelines will help prevent a third wave of infections. These simple guidelines will prevent another lockdown. We have a personal and social responsibility to adopt these protective behaviors and protective measures. Let us work together to maintain the health and well-being of our people. I thank you.